It is hiking season, and there are a host of health benefits. Along with building stronger muscles, lungs, and bones, hiking can also help with balance. But as with any physical activity, injuries can happen. So tonight, we ask the doctor about steps to take to stay safe on the trails.
Northern Nevada is rich with trails which offer a pathway to beauty, tranquility, and health. Hiking or trail running are great ways to get sun on your face, fresh air in your lungs, and even a boost to your mental health. It's a whole body workout from head to toe, which is why we're taking Ask the Doctor on the Rocky Road. Dr. Samantha Ralston is a podiatrist and a foot and ankle surgeon with the Swift Institute. The former Division I collegiate track and field athlete walks the walk when it comes to foot health. For starters, she always laces up in supportive shoes.
If you can squeeze the heel counter together and they touch, then it's not a great shoe to support your feet.
She's seen what can happen if you're not in proper footwear.
Lots of ankle sprains, ankle fractures, bunions, hammer toes. Plantar fasciitis is probably one of the most common things I see.
While some foot frailties can't be prevented, she says do what you can to avoid accidents.
You might be walking, step on something uneven, and just ankle kind of gives out. Playing sports, anything like that usually is the culprit.
Dr. Ralston recommends preparing for any activity by stretching, maybe using heat therapy, and most importantly, wearing sport-specific shoes.
Trail shoe versus a road shoe, because they got a different bottom. The trail shoes have a little bit more grip to them, so you're less likely to slip or fall on a trail.
A wider toe box may also help people with issues like bunions.
It's a bone deformity, so if it's bad enough, usually surgery is the only way to fix it, but most people's complaints are because it's rubbing in a shoe, so having a wider toe box shoe just prevents that irritation on their foot.
She believes surgery should be a last resort.
I always tell patients, it's your decision when you are in enough pain and you can't manage it that you need surgery.
But don't underestimate stretching, icing, orthotics, maybe even anti-inflammatories, especially if you sit for much of the day.
Back muscles of our legs get really tight, and so people get a lot more pressure and tension in the plantar fascia, which causes them to have plantar fasciitis.
And if you're on your feet all day, take time to recover. Also, if a big race is on your radar, ease into training.
Making sure you're building up slowly. So if you haven't been hiking in a long time, don't go for a 10-hour hike first day. Work it up, or a 10-hour run or anything like that. Just make sure you're slowly building up, and that will prevent injuries.
And I also asked the doctor if one injury will increase your odds of recurrent ankle injury. She said not necessarily. If you follow doctor's orders after an injury and do whatever you can to strengthen the muscles around the ankle. To learn more about Dr. Ralston and the Swift Institute, head to our website, 2news.com.